Hi, I'm Dr. Peter Coleman. I'm a retired physician and a board-certified addiction medicine specialist, and I have over 40 years of experience with my own recovery from opioid use disorder and treating patients and helping them. Today's chapter is a summary of what we're up against. I also, in the book, title it, "It's Not Your Fault." When we look at all of the things that happen for the disease to develop and then what happens as the disease is developing, there are some predictable stages well outlined by Dr. Nora Volkow, the head of NIDA, and other people. She's been describing these stages, and so I'd just like to review them, which is kind of a review of what we've talked about in the preceding videos. First of all, there's a genetic vulnerability. So almost everybody that I treated in my whole career had a family history, either a mother or father, grandparents, usually with alcohol use disorder, but sometimes with opioid use or other drugs. And then there's usually childhood trauma, often because they grew up with an alcohol use disorder parent. So that combination of genetics and childhood trauma creates what we talked about as the bucket model, where the bucket is almost full and it doesn't take much drugs to then overflow the bucket and create the disease of addiction. The first stage of the process is it's still fun. So there's high amounts of dopamine going off when the drug use is happening. The reward center is releasing way more dopamine with a spike than nature ever intended, and so it feels fabulous. It sends messages to the memory circuits to say, you know, this is amazing, we've got to remember this, and it creates all of these associated memories that then end up becoming triggers and get us in trouble in the future. That same dopamine spike in the reward center gives sends messages to the emotion circuit so that people fall in love with their drugs. They look for them, they miss them when they're not there, they overlook red flags, and they think this is the greatest thing since sliced bread. Then the prefrontal cortex, it has to decide and judge how much do we value all of this. Values it a lot, especially if you have that genetic vulnerability. There seems to be something about that where people who have that value this experience incredibly highly. And so decide to do it again at that time, and also decide to do it in the future. Stage 2 is withdrawal and negative effects. This is when the reward center starts to not release as much dopamine because it's kind of running out. And so people use their drugs, but they don't really feel the effect as much. Natural rewards start losing their rewarding events, so they all sort of become boring to the person who's using drugs. How could they possibly compete? As the dopamine comes in and then goes away, then it starts going below the baseline. So people start spending time below a normal person's baseline. And of course they want to use drugs to get back to normal, except as they use more, they get less effect, and then they start going further and further below the baseline. So before you know it, they're living below the baseline. And any drug that they use, they don't get high anymore. They get less and less effect until, as most of my patients would, when they came in, they said, I just don't get high anymore, doc. I have to use in order to avoid withdrawal, because the other thing that happens is the endorphin system that the opioids attach to, the opioid endorphin receptors, they get tolerant and they get depleted as well, so that people get opioid withdrawal. So they're not getting high. They can't use in order to feel good, and they're having withdrawal. They're having to use all the time. If that's not bad enough, the third stage is preoccupation and anticipation. So now the memory triggers are so entrenched that people are having triggers and cravings all the time. It's almost intolerable. They have to keep using. Their emotion circuits are so damaged that they have no ability to even know what they're feeling, and they have no ability to deal with those emotions like normal, healthy people. They're living in misery. The only relief they can get is to use some more drugs. That only gives temporary relief. It doesn't solve any problems, and it wears off really quickly and makes people feel even worse when it wears off because the problem's not solved and nothing's ever gotten better. A sense of hopelessness starts to set in. The prefrontal cortex has also been damaged. It can't see reality clearly. It can't make good decisions. It can't decide whether this person's a good friend or that one is a good friend. It loses its ability to delay gratification. It loses its ability to know what social norms and what's healthy behavior. And it can't decide whether this is even a problem or not. Denial is creeping in so that people start thinking this is normal. Maybe worse than all, it loses hope. The prefrontal cortex can't see that there is another whole way to live, that people don't have to live in this misery. When you see this cascade of events that happens, genetics, and then leading to this predictable cascade, you realize it's not anybody's fault. Nobody wanted to become a drug addict. When people started using to have some fun, to be like other people, whether it was alcohol or pot, they had no idea that because of their genetics and their trauma and their setup, that their brain was different and that they would end up in this position. It's kind of a miracle that anybody gets out of this position, but they do. People recover all the time. But I found that when people understand how their brain works and how addiction has affected them, they are able to make the right decisions. They're able to forgive themselves and realize that they have a brain injury, they have this brain disorder, that it's not their fault, but recovery is 100% possible as long as they just take the right steps and keep working at it. They need to work hard at it, and they need to make recovery their number one priority. I'm thinking of a patient that came to see us a while back, and we were able to detox him, and he wanted to go on to long-acting naltrexone. So we actually put a naltrexone implant in him, and he went off to a 28-day rehab program. And they kept him on Vivitrol after the implant had worn off and referred him to a halfway house back here in Richmond. And he stayed in a halfway house for about 12 months, and he did incredibly well. He participated, he did some intensive outpatient program at the first part of that stay. He got himself a job, he got his license back, and he kept growing. He got some individual therapy, and he has been doing very well ever since. So the bottom line is people do recover from this disease. They just need to take it seriously and make the right steps.